I had a patient today where he has chronic inflammation of his salivary glands, but we did sialoendoscopy and the duct system was anatomically normal and the salivary glands were anatomically normal, and there was no sign of any tumor or stricture or infection to account for the inflammation. So this is a fairly common thing where people have inflammation with no readily discernible cause. And in many of these cases, it's most likely that they have a kind of a global inflammatory state, and the inflammation that we're dealing with is just one manifestation of their globally inflamed state. And so I thought this was a good opportunity to go over this concept and go over some of the dietary interventions that can be done to help with this problem. Okay, so I found these two papers, which we'll go over. This one, the first one was published 2 years ago, Western Diet and the Immune System and Inflammatory Connection. It says the consumption of Western type calorically rich diets combined with chronic overnutrition and a sedentary lifestyle in Western society evokes a state of chronic metabolic inflammation termed metainflammation. Metainflammation contributes to the development of many non-prevalent, non-communicable diseases, and these lifestyle-associated pathologies present a rising public health problem. A better understanding of how modern lifestyle and Western diet activate immune cells is essential for the development of efficient preventative and therapeutic strategies for common NCDs, non-communicable diseases. We review the current mechanistic understanding of how Western lifestyle can induce meta-inflammation. We discuss how this knowledge can be translated to protect the public from the health burden associated with their selective lifestyle. Okay, what does this mean? It just means that most of the people in the developed world eat a diet that has a lot of calories, and so we are chronically having more calories than we need, and we lead a lifestyle where we do not expend much energy. We don't, we drive cars and we work office jobs. And so that lifestyle is kind of relatively a new thing in the history of humans. Before, for much of human history, generally getting enough calories was the problem. People were generally in a state of caloric deficit most of the time, and every once in a while there was enough food that people could kind of catch up on their caloric deficiency, and they worked jobs as farmers or some other physical labor where they used a lot of energy, and then there were no conveniences. People generally walked everywhere, and so right now if you told someone that you walked 15, 20 miles, that would be considered a lot of walking. But 1,000 years ago, 10, 20 miles of walking a day was probably the norm that everyone just did. Okay, so anyways, this over too many calories, sedentary lifestyle, and the type of food we eat leads to this inflammatory state, which leads to a lot of the diseases, non-communicable diseases. This is like a heart disease, stroke, cancer, diabetes. These are all the most common problems that we face in modern society in the developed world. Okay, so here they talk about how sanitation and clean water have attributed, and vaccination and antibiotics have attributed to dramatic increases in our lifespan. But now, these non-communicable diseases that we just talked about cause more than 80% of the deaths in Western society. They're talking about metabolic syndrome, diabetes, liver disease, uh, um, cardiovascular disease, neurodegenerative diseases, and cancers. All right, so let's go down. And so here it is. One of the changes in lifestyle has occurred in the decades in Western society is the increase in consumption of Western type diets. This includes processed foods. So processed foods essentially is any food that has a list of ingredients on it. And I dare say that that's what most of us eat most of the time. Fast food, convenience foods. These are foods that are, pre-packaged, pre-cooked foods. You find these at every grocery store, and you can nuke them or just open a can or just do very simple cooking and prepare them. Snacks and sugary soft drinks. These have a lot of calories, but they lack fiber, vitamins, and minerals. Increasingly, these food products have made their way from high to low income countries, and with it, an increase in Western diet associated diseases, that we've just talked about. Okay, So then this is the first table. And this talks about these nutrients and whether they cause more inflammation or they decrease inflammation. So this is saturated fatty acids. This is like butter, margarine, lard, animal fats. These are pro-inflammatory. Unsaturated fatty acids. These have they're kind of neutral. And then omega-3 fatty acids, these are anti-inflammatory, and you might have heard of these. These are very, if you've read anything about these health studies or anything, these are a type of fatty acid that's found in usually most commonly in fish oils. So they're DHA and EPA are the fish oils. There's another kind of omega-3 fatty acid called ALA or alpha linoleic acid that's found in kind of like flaxseed oil and some other vegetable sources. So those are anti-inflammatory. Cholesterol is pro-inflammatory. Cholesterol is found in animal products, and cholesterol is not found in plants. And then sugars. This is a huge one. The consumption of sugars in America has gone from about 4 pounds of sugar per year per person to about 160 pounds per year per person. Um, so that is a dramatic increase in the consumption of refined sugars. That's pro-inflammatory. Fiber is anti-inflammatory, pro and anti, but mostly anti. And so fiber is just present in any plant, basically. This doesn't mean just like go out and get Metamucil. You have to have a wide variety of fibers. Then other dietary metabolites, purines, carnitine, histidine, these are all byproducts of basically meat protein metabolism. These are all pro-inflammatory. Polyphenols, these are compounds found in plants, and these are anti-inflammatory. These are things like resveratrol and quercetin, other things like that. This is short chain fatty acids. These are usually anti-inflammatory. These are found in uh, probiotic foods or fermented foods like kimchi, sauerkraut, natural pickles, um, yogurt, those kinds of things. Cholesterol, I have no idea what this was, so I had to look it up. It's evidently a compound found in the root of something called the thunder god vine. Never heard of it. I don't even know where you would get this thing, but evidently that thing is anti-inflammatory. Okay, so they're talking about all those things that we just went over. And then here's the other table. And of course, I'll link this in the description so you can read this at your leisure yourself. And I recommend that you do read it. It is quite good. These are talking about all the studies that looked at this dietary component. So glucose or sugar, it's all bad. And then cholesterol. This is also found to be not good. Saturated fatty acids, not good. Omega-3 fatty acids, good. So decreases inflammatory markers. Fiber, good. Polyphenols, good. This polyphenol resveratrol, also good. Or no effect on these. This is a polyphenol found in green tea, so good. Another tea type thing, good. Increased interleukin 10, that's kind of a immunosuppression molecule. And then this is CRP, TNF alpha, and IL-6. These are pro-inflammatory markers. And then polyphenols in fruit, good. Okay. And then they talk about the gut microbiome, which is, there's a couple of videos on the microbiome on this channel that you can look at if you're interested in that. But basically what we eat changes our microbiome. And the microbiome affects our immune system and also affects our brain. And so there's this thing that's called the gut-brain immune system axis. And then adipose tissue, having a lot of adipose tissue, a lot of fat in your body is pro-inflammatory. And that's, if you look at the video on nasal congestion, we talk a little bit about that as well. And then here's the liver, central nervous system. So this is talking about the gut um, the gut immune system brain axis. And then also like chronic stress and uh, brain anxiety and stress will trigger these things as well. So it kind of works both ways. Like uh, uh, a dysregulated microbiome in your gut will predispose you to have like anxiety, depression, and other kind of psychiatric dysfunction. And then the other way around, psychiatric dysfunction will actually make you more have more stress and inflammation in your body. And then this is talking about trained immunity and sterile inflammation. This is what's going on. Their thought process here is that the modern society is very clean, and then our immune system becomes triggered against non-infectious targets, such as lipid metabolites, high amounts of glucose, glycation end products. These glycation end products are found in meat that's cooked at high temperatures, fried, grilled, seared meats. Um, and so that can cause problems. Another big theory is that our immune system is dysregulated by a lack of exposure to helminthic and parasitic organisms. And there's a video about that, about helminthic therapy on this channel that I'll link in the description as well. Okay, so let's go to the final remarks here. Um, So what they say here is adherence to a low-risk lifestyle. So no smoking, because smoking is obviously inflammatory. That's a toxin that your body has to deal with. Regular physical activity, moderate alcohol intake. My personal take is no alcohol intake. Alcohol is essentially also a poison that your body has to deal with. And consumption of high-quality food can be very effective and potentially extend life expectancy. Okay, so let's go to this other one. This one's talking about rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease, so this is also driven by inflammation against our own body. And they talk about how there's many studies that show that dietary interventions can substantially benefit people with rheumatoid arthritis, and likely this can be translated to other inflammatory conditions. So what did they say? Dietary interventions. 7 days of fasting followed by a vegan diet. This was found to be very effective. And so fasting is a natural state for our physiology. Like I said, early on in human history, chronic caloric deficiency was kind of the norm. And so people fasted for long times, not because they wanted to, but just because food wasn't available. And so our body were meant to deal with times of no food or very little food, and that's actually very healthy for your immune system. And so fasting followed by vegan diet was found to be very helpful for this inflammatory state. A vegan diet is shown to be very helpful as well. Vegan meaning that they only take fruits and vegetables and eliminate any animal products. That means no eggs, no cheese, and as well as obviously no meat. Mediterranean is a diet rich in oleic acid and omega-3 fatty acids. So if you're going to do fish oils, you can either take them as a pill, or if you want to get them from fish, it's most healthy to get it from small oily fish like sardines and smaller fish. The larger fish like tuna and salmon, those fish have a higher buildup of heavy metals because they're higher up in the food chain, whereas smaller fish like sardines and uh, fish like that have less bioconcentration of toxins in the environment. Okay, and they have a high consumption of olive oil, cereals, fruits, vegetables, fish, and legumes. Less red meat, and inclusion of a moderate amount of red wine. The good component of red wine is the resveratrol, which is found in grapes and berries too. So it's not the alcohol of the red wine that's helpful. It's the polyphenols in the red wine that's helpful. Elemental diet, won't go into that. This is a diet that's not sustainable. Elimination diet. So this is actually helpful, and we briefly talked about that in the nasal congestion video. But basically, there are certain like low-grade allergies that people have to certain foods, and by trying to eliminate portions of your diet, you may find the trigger that's triggering your immune system to be inflamed. So it may be dairy products. Sometimes nightshade vegetables are a trigger. Those are like potatoes, eggplant, peppers, tomatoes. So you could try eliminating those. Some people have various amounts of reactivity to gluten, which is in wheat products. So there's various things that people can try to eliminate and see if that is their trigger. Dietary fibers and whole grains obviously were found to be very helpful. Fruits, very helpful, and especially berries. Berries are probably the most antioxidant and helpful fruit um, of all the fruits that you can do. So blueberries, raspberries, um, mulberries, that kind of thing. Spices, ginger and turmeric, and then essential fatty acids. So omega-3 fatty acids are good. So flaxseed oil, fish oil. Synbiotics or probiotics, those are like kefir, yogurt, kimchi, sauerkraut, natural pickles. The pickles that you find in the grocery store are usually not naturally pickled, like using salt and thyme. They're kind of they're pickled using vinegar, so that's not very helpful. You need to have the pickle that was pickled with salt and thyme, so that bacteria can ferment the cucumbers, like as is done in kimchi and sauerkraut. Alcohol consumption was kind of some studies showed that it was bad for rheumatoid arthritis. Some showed that it was kind of neutral. So overall, I probably avoid it. Tea was helpful. And then there's these herbs, which I've never heard of before. I don't even know how to say this. Salaki, ashwagandha, not sure. I don't know where you'd get that, but those were helpful. So they believe the ideal meal includes raw or moderately cooked vegetables, lots of greens and legumes with the addition of spices like turmeric and ginger, seasonal fruits, probiotic yogurt. I don't know. You could also substitute that for probiotic sauerkraut or kimchi, all of which are good sources of natural antioxidants and deliver anti-inflammatory effects. Patients should avoid processed foods, high salt, oils. So when they say oils, they mean seed oils like soybean oil, canola oil. They don't mean olive oil. Butter, sugar is the big one, and animal products. So they say avoid animal products, and then they put yogurt here. Yogurt is an animal product. So and then so that yeah, so that's what they recommend. So there is the recommended diet. Lots of fruits and vegetables, greens and legumes. Legumes are beans, any kind of bean. Whole grains. Um, if you like turmeric and ginger, you can add those into the cooking. Lots of fruits, especially berries, and then avoid these things. And this is the thing that everyone eats. Everyone eats processed foods with lots of salt, lots of oil, and lots of sugar. Like think of all the foods that are the common Western diet. Hot dogs, yeah, burgers, French fries. That's high salt, high oil. Um, um, Pizza. Yep, that's high salt, lots of oil, um, lots of cheese and animal products. Ice cream, dessert, um, sodas. Um, and then, people eat chicken thinking that's good, but, if you had fried chicken, well, that's a lot of oils, and then that's a lot of it, glycation end products. Most meat that's eaten is either processed like salami, bologna, ham, pepperoni, or it's meat that's seared or grilled. That adds to a lot of carcinogenic and pro-inflammatory products by cooking it that way. If you cooked meat in a way that didn't generate those products, it'd be pretty not tasteful. Um, so anyway, that is the recommended diet, and so that's the diet that if you're dealing with chronic inflammation, those are the things you could try. And of course, exercise is good for that, and mental health, taking care of your mental health is going to help with chronic stress and inflammation. I hope that's helpful to someone. Thanks for watching.